So, if you could share a story about a time where you struggled with your mental health and there was someone that really supported you and helped you get through it, or roles reversed where you had someone in your life who really struggled with their mental health and you feel that you helped them and you supported them and helped them persevere through that. If you have both stories, we welcome that as well.
Gotcha. Yeah. I guess mine can kind of intertwine. So, throughout my life, I've just had a lot of struggles with kind of family stuff, especially my dad. There's been a strained relationship there. He's been in and out of like the prison system since I was a child, and that's always been something that I've struggled with because it's kind of for the longest time been just me and my mom, and it's hard to pay for school, you know, kind of live that life and have not really have like that father figure. My senior year of high school, my dad had been out of prison for a couple years at that point, and I just started to kind of build that relationship with him again, and he ended up going back to jail. And it was a really difficult situation for me because I experienced that from a young age. First time he got arrested, I was 10. I was actually there on the scene when he got arrested, and that kind of started my mental health journey. But it was difficult as a 17-year-old boy to kind of internalize that trauma and pain, and it ended up really just sending me into a downward spiral. A couple other things impacted that as well, but I, I kind of had the stereotypical depression. I didn't go to school for days. I wouldn't get out of bed. I had no motivation to do anything. I had a lot of thoughts of self-harm, and even at some points I had thoughts of, suicide. The person that really helped me through that situation, I have to say, was my mom. She's kind of been with me through my entire life journey, and through the good times and the bad times, and having her to support me, as well as be that rock if I needed someone to talk to, as well as just kind of motivating me to be like, you can do it, like one day at a time. You can make these steps to kind of get yourself out of this depression that you're in, and kind of validating me that the feelings that I have are real, and the feelings that I have are, it's not just make believe. It's really interesting that several years later, or a couple months later actually, after that, I became a peer at Sean's house, and then eventually got promoted. And one of my first sessions that I had at Sean's house as a new peer 24 lead was a very similar situation to my own. A boy came in who was in middle school, who his dad had been in and out of the prison system, and he'd just been struggling to kind of deal with that pain and know how to properly attend to it. And it was just really fulfilling to have that situation where I could help him go through something that I had gone through myself, and see that, I got something from it as well, or showing that I'm not alone in that situation, but I hope that I was able to help him with his situation, to kind of give him the help that I didn't have when I was a kid.
Yeah.
In my position as a coach and working with women and also non-binary students, the biggest thing has been mental health, at least from when I've started since this past fall. I think that it's easier for students and ourselves to shy away from wanting to be open and talking about our struggles. So my biggest thing, beginning of practice, or even when we're at games, ensuring that I'm asking for just a temperature check. And I did that when I was an elementary teacher too, of like, where are you at? How are you feeling today? I think if you don't have that gauge, you're not going to be able to pick up on if things start to kind of seem off with somebody as the day goes on. So that's just a great way to get a way to kind of check in. And after I kind of started that, I noticed this past spring a lot more students and players on the team opening up to me about things that are going on at home, with school, stressors, students who also have barriers that don't have to do with those sort of things. There's barriers with mental health that are not just because of our environment. A lot of things are innate, things that we're born with, can't control. So just trying to be as supportive as I can in a listening ear, and trying to take that one step forward, because I do work at the University of Delaware, sharing resources that we have here for students so that they can get that extra support. It's not a one-stop shop, and it's a continuous journey, so just ensuring that students know what they have and knowing that there's at least somebody there that cares.
And I had a student write me, and she goes, can I really talk to you and you can't tell anybody? And I said, yeah. she said, "Can I meet with you this afternoon?" And I'd left the afternoon open for this purpose. And I said, "Yeah." So we met a couple minutes later at my office, which, as you know, is at Grotto's Pizza. And I said, "So tell me what's going on." And she goes, "Well, you mentioned all of those signs." She goes, "I think I have every one." And we got into a very good discussion. And she didn't want to tell anybody, she didn't want to tell her parents, but we got to withdraw some of the stigma, and won't go into detail. But she immediately went and got help. She continued to meet with me because she felt safe. But we also moved her into talking about it with her parents, and they getting her a really good counselor to meet with. And at the end of the year when she graduated, and I wrote a letter of recommendation for her to get into grad school. Then 3 years later, she graduated from grad school. And sometimes I almost shudder to think, what would have happened if she had not heard that, and then she had not reached out? And I just simply gave her those simple words: "Tell me more about that." And to this day, she's doing great, and I love that.
So a big part of what we do at NAMI on the education support team is we go into elementary schools, middle schools, and high schools and give presentations about mental health, stigma, how to know when other people are struggling, how to know when you're struggling. And one of the big components of that is that we give them paper and pencils. So if you want to ask a question but you don't want all your classmates to know you asked it, you could write it down. And at the end, we pass the papers up, and obviously we keep an eye on whoever passes the paper. So if there's something concerning, we know who said it. About a month ago, I would say, we were in an elementary school presenting to fourth graders, and I got one of the notes that said something super concerning. Just, what do I do if I feel like hurting myself because my parents are getting divorced? What do I do if my friends think it's okay to hurt myself? And what if I'm showing signs of an illness before the age of 14? So I looked for the girl that handed it up, and I pulled her aside after class, and I just started talking to her about what was going on, and if she had any support that she felt comfortable, any trusted adults she could talk to that could maybe help her connect her to resources. And she said she really loved her guidance counselor, but she was really afraid to tell her by herself because every time she talks to her friends about it, I basically just said that that was normal and it was things they were experiencing as well. And so I told her I would go to her guidance counselor with her if that would make her feel better, and she said absolutely. So I held her hand, we went to the guidance counselor together, and she was able to talk to her guidance counselor about the thoughts she was having about harming herself, and her guidance counselor was able to connect her to resources to help her get through that, and also to be able to work towards telling her parents together, which was awesome because even if someone has a trusted adult, it's not always easy for them to make that first step of coming to them.
So when I was a junior in high school, I lost my friend Brendan to suicide, and it was partially me. I wasn't ready to talk to anyone about it, and I would say it was also partially my community. I didn't really know of anywhere that I could go. I knew I had school guidance counselors, but I really didn't. They were all for classes and getting ready for college, so I didn't use the resources that I had, but I also didn't really feel comfortable with sharing with anyone at that point how much I was struggling. I think loss by suicide is really unique. There's a lot more, I think, guilt than other grief, and just generally going through the grieving process. So that was really hard for me. So I didn't really start processing that until a whole lot later than I should have. But I think something that's been a really cool opportunity that Sean's House has brought to me is being able to see someone that was really in my shoes. So my sophomore year, when I was first involved at Sean's House, I actually was able to meet with a junior in high school who had lost her friend to suicide. And being able to talk her through what she was going through and helping her to start that grieving process as early as just a few days after her friend had passed was not only really powerful for me to be able to help her with that, but also for that to even heal a little bit of myself in just trying to speak to what I wish I heard. And in my processing and in learning to be a peer and going through all of my coursework, really being able to have a better grasp on what I wanted to be able to say to help her through that challenge.